Welcome to my YouTube channel. My name is Wakbo. I'm a third year student at Maradi University pursuing Bachelor's of Physiotherapy. Today, I'm going to be presenting the topic of electro diagnosis, specifically H reflex and F wave, as a part of my rubric 3 assignment of PFD. That's with H reflex. H reflex is also known as Hofmann reflex, coming from the name of the man who developed it, who is Hofmann. And it's a diagnostic tool for radiculopathies and peripheral neuropathies. And again, it's obtained by the submaximal stimulus. It has been observed that it's absent in all nerves of the body except the tibial nerve, femoral nerve, and median nerve in adult population, and it's present in any nerve for pediatric population. And the circuit of the H reflex, it involves the stimulus, the afferent, which is sensory, that passes through the alpha muscle spindle, and it reaches to the spinal cord where it synapses and comes back as a reflex into the motor neuron and the axon as the efferent part. The diagram here shows the H reflex pathway. On the submaximal stimulation, it passes through the alpha muscle spindle, which goes to the spinal cord and synapses with the motor neuron and comes back to the muscle, stimulating the muscle, causing H reflex. If we increase the intensity of the stimulus is going to stimulate the sensory pathway and the motor pathway, and then this leads to collision in the motor neuron, which coming back and reducing, hence reduction of the H reflex intensity, and also formation of the M wave, which is the muscle stimulation. And on increased stimulus, there will be formation of the M wave, which is bigger, and as we increase the stimulus, the H wave goes reducing in the size. The measurement of H reflex are affected by the limb length, age, and temperature. And the application of H reflex is the diagnosis of the radiculopathy and peripheral neuropathy. Now let's continue with F wave. F wave is obtained by supramaximal distal nerve stimulation, and it works under the principle of antidromic and autodromic impulse transfer throughout the nerve. F wave is a pure motor component, and the measurements that are obtained during F wave measurement is latency, persistence, and chronodysphagia. The figure here illustrates the procedure and the response obtained during F wave procedures. And as I said earlier, F wave is obtained through the autodromic and antidromic nerve transmission throughout the nerve. And whenever there is stimulation, distal stimulation of the nerve, the impulse that passes autodromically, it goes and causes formation of M wave immediately. And the impulse that causes antidromically, it's not allowed to cross the synapse. Hence, it comes back and also causes formation of the F wave. F wave is actually having the component of 1 to 5% of the M wave. And we've continued the procedure with distal stimulation. The M wave latency is relatively small compared to the F wave latency. And as we go to the proximal stimulation, whenever there is proximal stimulation, the M wave latency increases and the F wave latency. Now let's take a look at measurements that are obtained in F wave. The F wave measurements, they include latency, persistence, and chronodysphagia. Let's start with latency. Latency is said to be normal in upper limb when it's less than 30 milliseconds, and in lower limb when it's less than 60 milliseconds. And then F wave persistence. F wave persistence is the persistence of the number of waves that are obtained according to the number of stimulation, in relation to the number of stimulation. The normal range that is obtained is 80 to 100% of the stimulation and the number of the waves which are obtained. And let's go to the chronodysphagia. Chronodysphagia is defined as the difference between the fastest and the slowest F wave. And the normal response obtained is said to be 4 milliseconds in upper limbs and 6 milliseconds in lower limbs. F wave absent in normal patients who are not sedated or sleeping indicates the axonal loss. Thank you for your attention. Please like, share, and subscribe.